semaglutide, the recommended dosage is the maximal dose, which is a 2.5 milligram dose. This is not where we start patients. We actually start patients on 1/10 of that amount. So when they first come in to see us, we determine if they're an appropriate candidate. If they are, and we decide to move ahead, the first week we would start on a 1/10 dose compared to where we'll be when we titrate up to the full dose of the medication. And in terms of duration, here at Plaza Aesthetics and Wellness, we do require that patients sign up for a 6-month program. What we've seen in the clinical trials is that patients likely will need this medication long-term. They may potentially be able to titrate down slowly off the medication. We would never want them abruptly stopping the medication. Once the patient has received 6 months of treatment here at Plaza Aesthetics and Wellness, we sit down with the patient and kind of look at where their progress has been, if they continue to have more weight loss that's needed, or if they have achieved their goal. And then we determine, again, if it's more appropriate to potentially titrate down on the medication, see if they're able to tolerate that, or stay on the medication on the amount that they kind of reach for their peak or their max. We also are able, because we use a compounded semaglutide, occasionally patients will have side effects to where they're unable to titrate up to that 2.5 milligram dose. So occasionally we have patients that will start, they're not seeing much weight loss, and they really see the maximal weight loss at that 2.5 milligram dose. I would say this is not, after prescribing this medication for a year, that's not typical. What we're really seeing with most of our patients is after 1 or 2 doses, they're seeing significant weight loss. And even with very small amounts of the weekly injectable, the subcutaneous injectable semaglutide, they're starting to see weight loss very quickly. What we would expect is about 1 pound to 2 pounds a week. When a patient comes in for their initial consultation, again, we do a very comprehensive history, and we will discuss with patients that they need a 6-month comprehensive program. We really try not to stray from this. This has been the best program from our experience, that a patient really requires a 6-month program to get started. When the patient hits their 6-month mark, we sit down with them and determine, are they at their goal? Are we still working to meet their goal in terms of weight loss? If someone has met their goal, we can either stay at that dose that we're currently at for the semaglutide, or we could potentially consider titrating down on the medication. We would rarely recommend ever abruptly stopping the medication. We would want this to be a decision between ourselves and the patient that we make together. What's the best treatment moving forward? Now, if the patient is still requiring weight loss, let's say they have another 20 or 30 pounds to meet their goal, there is a chance we may continue to titrate up on the medication if they haven't titrated to the highest dose. If they still are at the highest dose, then we may just need to continue at that higher dose, but with more counseling and behavioral modification, continuing to see myself, my nurse weekly, also continuing to see our dietitian weekly.